Knee pain can be debilitating and impact your quality of life. When conservative treatments such as medications, injections, and physical therapy no longer provide relief, knee replacement therapy may be recommended. Knee replacement therapy is a surgical procedure that involves removing the damaged knee joint and replacing it with an artificial joint. Understanding the procedure. The knee joint is made up of three parts: the femur, thigh bone, the tibia, shin bone, and the patella, kneecap. During knee replacement therapy, the damaged parts of these bones are removed and replaced with artificial components made of metal and plastic. The procedure is typically performed under general anesthesia and takes about 2 hours. A surgeon makes an incision in the knee and removes the damaged joint. They then shape the remaining bones to fit the artificial joint, which is then attached to the bones using cement or a special material that allows the bones to grow into the implant. Recovery from knee replacement therapy. After surgery, you will typically spend a few days in the hospital. During this time, you will be given pain medication and physical therapy to help you regain strength and mobility in your knee. Once you are discharged from the hospital, you will need to continue physical therapy on an outpatient basis. This will help you regain full range of motion in your knee and build strength in the muscles surrounding the joint. Most people are able to resume normal activities, such as walking and light exercise, within 6 weeks of surgery. However, it can take several months to fully recover and regain full strength and mobility in your knee. Risks and complications. As with any surgical procedure, knee replacement therapy comes with some risks and potential complications. These may include infection, blood clots, nerve damage, and an allergic reaction to the anesthesia. In rare cases, the artificial joint may become dislocated or fail, requiring additional surgery. However, the vast majority of knee replacement procedures are successful, with most people experiencing significant pain relief and improved mobility. Conclusion. Knee replacement therapy can be a life-changing procedure for people suffering from chronic knee pain. If you are considering knee replacement therapy, it is important to discuss the procedure, risks, and potential benefits with your doctor. With proper preparation, physical therapy, and post-operative care, you can expect to regain strength and mobility in your knee and enjoy a better quality of life.